All right, Instagram, we're here. Thank you so much. Thank you so much for joining us for another interview with King Solomon Entertainment and Media Group. Thank you guys so much for all the outpouring of support on all platforms. We just thank you, thank you, thank you. We could not do what we do without our partners. We want to thank GQ Auto Complete Service Motors for their wonderful partnership. We want to thank the Kathy Jones with the heart to heart for you.org and the heal2heal.org for their wonderful partnership as well. We want to thank physical therapist Amanda J. Rosette for her wonderful, wonderful partnership and the wonderful service that she's doing. Please reach out to all of our partners and sponsors. Let them know that you heard about them from here, as well as the Tommy Washington Massage Therapist Group as well. Let them all know you heard about them on our platform, and they'll give you the King Solomon discount. We appreciate you. If you yourself are interested in partnering with us and sponsor with us, please reach out to our official website, kingsolomonentertainment.tv, and send us an email, and we'll let you know how to do that. If you have not subscribed, now is the best time to subscribe at King Solomon Entertainment Media Group, both the same thing on Twitter and on YouTube, right there in our title. Check it out on Facebook. We are King Solomon ENTCO, as well as Instagram. We are King underscore Solomon underscore ENT underscore CO underscore. That's Instagram with the underscores. Thank you guys so much. Today, we have another wonderful guest, friend to the show. And I attempt to even do his accomplishments any justice, but I'm going to try, and I'm so glad to have him back on. He is, of course, member of the American Heart and American Stroke Association, where he served. He definitely had a wonderful, wonderful Ivy League undergrad staffer. I love that school, and UC San Diego Medical School. He also is a former executive. I think he was the director at the Comcast, as well as the University of NBC. He's also a certified medical board member as well, and the founder of the BlackWomen'sHealth.com. Please welcome once again to our platform here on King Solomon, Dr. David Pryor.
Hey, good afternoon. Good afternoon, King Solomon Entertainment. Glad
Thank
to be
you.
back.
Oh my God, we're so glad to have you back. He definitely legitimizes our platform when we have a MD on our platform. So everybody said, "When are doctors coming back? When are doctors coming back?" I'm like, very soon. So I really appreciate your expertise and what you definitely bring to the platform and what you're doing for the community and your contribution at large. We really, really thank you. It needs to be shown more. How you definitely making a difference really in such a time as this. I know last time we focused on the American Heart and American Stroke Association. It's kind of like get a little update on that in regards to COVID. How are the conditions now? Have the numbers going down? Where are we with that, Doctor?
Yeah, well, good news. I mean, things are certainly looking better. We had a rough time there, especially after the holidays, after Thanksgiving, after Christmas, and into January. It was tough, right? And
Yes.
not just in Los Angeles, but really all throughout the country. So good news, things are looking much, much better. The rates of positivity of COVID positive tests have gone down dramatically. The
Mm.
hospitals have a lot fewer patients in them now. And so, this is a good time, right? We can't take our foot off the pedal. We can't stop yet, but things are getting better, and we are starting to see, maybe we're starting to get back to normal in the near future. So things are looking better.
Yes, I know in regard to the stroke, as far as we say how to recognize when the stroke and when the it happens. So was it the numbers? Did they turn around? Did you get more cases during COVID? Were people recognizing the symptoms during COVID, or did they think it was COVID itself and it was
Oh,
something
I
else?
see. Yeah. The
Yeah.
relationship with COVID and heart disease. Well, that's been something that's been very interesting that as, COVID has come on, right? We first thought it was just a respiratory disease like the
Yes.
lungs, right? Kind of like flu. But then we did start to learn that it had these other ramifications for the heart, right? And, some people that were having, congestive heart failure and other
Mm,
heart ailments. So we are still studying that. And I think the interesting thing there is what are going to be the long-term effects, right?
mm.
Obviously, far too many people passed away, but a lot of
Mm,
people obviously recovered, right?
mm.
Which is a good thing. But now we actually are starting to monitor people to see, are there any consistent long-term effects from
Yes.
COVID, especially on the heart? And so that's why I'm part of the board with the American Heart Association here in Los Angeles, and we're looking at that very closely and really trying to be supportive to the community. But in general, I would say the big message here, just wherever you're at, is just really make sure you're paying attention to your cardiovascular health, right? Your heart health, meaning your blood pressure, and making sure that your heart is healthy, you're eating right. All those things are very important.
Yes. And so in regards to, I know a lot of people was concerned when COVID first happened, getting services. So like when they would go, they couldn't even be allowed in. So have that changed in as far as regards to the medical emergency rooms and hospitals? What is the procedure now for those who may not have been or know as far as how it was before?
Yeah, things are starting to open up. I think one of the biggest changes we had with COVID and the hospitalizations, even right now, is that, if your family member's in the hospital, pretty much they're not allowing you to be in the hospital. You know how you used to have a family member in the hospital and you'd go and visit them in the room and sit there? So that has not started back yet, right? And I don't know, that's
Hmm.
probably going to be a little bit of a time. So that's one of the biggest changes. But the other thing is that if you are ill, if you're sick, you certainly can go into a hospital or to your doctor's office and receive services. There was that period around last, March or April of last year, right, where a lot of the offices were closed and everything was done via telehealth, right? The
Yeah.
phone appointments or video appointments. So that's still taking place,
Hmm.
but most of the medical offices and doctors' offices and obviously hospitals are starting to open back up. And so
Yes.
the biggest thing there is if you're having some problems, don't stay at home and don't be fearful. You can go to the hospital, go to your doctor's office, and they have all the procedures in place to make sure you'll be safe.
Well, we just excited about the services that is taking place now, how it becomes like a 360 once they knew how to service people and what to do. They just needed to know how to be effective in moving and how to maneuver during this pandemic. And so definitely see the changes of now, but in comparison, it seemed like we were locked down, everybody else was open because California did not play about the lockdown. And
Yeah,
so, yeah, so we experienced a lot more restriction.
that's very true. That's very true. And so, the honest thing is that they're going to be, for years, continue to study this, right? And study the
Yes.
reactions. I was reading an article the other day. They were looking at how California responded and how Florida responded, right?
Mm,
Florida was much more open and
mm,
and and that. And so at the end of the day, they were looking at it and they said, well, the case rate in Florida versus California wasn't as different as you would think, right?
mm.
So people are starting to wonder what really was the right thing to do. I'm sure we did the right thing in California here, but I think people are going to be studying this for years, as if you ever have another pandemic, to see what really made the biggest difference, right? But I'm glad that we are starting to turn the corner. Our schools are eventually going to be opening up for the kids, right? That's so important. Where, like you say, other states, some of their schools have been open for a while now, so we're starting to come around, and it's going to get better.
Yes. And so the doctor was invited back to the platform to definitely give us an update, but we also wanted to know about the vaccines. And so
Yes.
I know there was phase one, phase two, and now we in the Johnson and Johnson phase three. So if you can kind of elaborate on the phase one, phase two, and now the phase three of the vaccine, how important it is.
Yeah, well, that's the most important thing. And I think that's the thing that's making such a big difference right now is getting vaccinated. So whenever your turn comes up, whenever you're eligible, I'm urging you to get vaccinated. As you know, there are three vaccines available, right? The first one was the Pfizer vaccine, then it was the Moderna vaccine, and now it's been the Johnson and Johnson. And so quickly, the Pfizer and Moderna vaccines, they both are what's called an mRNA vaccine. Both of these are two-shot vaccines, right? You get two
Hmm?
shots. The Pfizer, it's 21 days apart, and the Moderna is 28 days. The most recent one that's been approved is the Johnson and Johnson vaccine. And
Mm,
the big thing about that, as you know, James, was that it was a one dose, right? As
mm,
opposed to you need two doses of it.
mm.
And so that's been very interesting. One thing
Yeah.
I'll say is that in the press, you may have read which one's more effective, right?
Ah.
And the Pfizer and Moderna, they've been said to be 95% effective, and they
Mm.
said that the Johnson and Johnson 66% effective, right?
Uh-oh.
But now people say, "Wow, well, why would I want to get Johnson and Johnson? It's not as effective." And I think the key thing here is you got to really read the fine print. The Johnson and Johnson vaccine, when they did the clinical trials, it was a little bit later on than the others, and so they had these variants, like in Britain and in South Africa and Brazil. So it was actually tested against all these other variant viruses. So that's probably why it was a little bit less effective. But here's the
Mm.
very important point. Okay, when you read the articles very closely, even the Johnson and Johnson, right? Everybody that got that vaccine in the trials, okay, none of the people that got the vaccine, none of them were hospitalized and none of them died, right?
Mm.
So when you look at that part of it, that's really that severe illness, it was really highly effective. So that's why all the doctors will say, it doesn't matter which one you get, just get vaccinated. Because the end of the day, James, the biggest thing is, right, if you get COVID, you don't want to get hospitalized and you don't want to die, correct?
Correct.
Those are the biggest things. And the Johnson and Johnson was very, very effective at preventing that. So wanted to point that out.
Yeah, but I think the concerns was for survey and what questions I've been asking is
Yeah.
that the when they first came, people was just panicking about the fact that they didn't know what was going on about the vaccine when the visor hit, and also it seems as if it was limited because they didn't know how they were selecting who was going first, et cetera, et cetera. Then they heard about it's only for the rich and all that.
Yeah.
So then you have a second phase, and I just think that they could have did a better job at informing people properly on what was the procedure. And then here come the third phase, and ironically, it's named Johnson and Johnson, which is a respected brand in the African American community. So speculation just have run wild in the sense of what's going on now because it was not explained properly in the beginning. But I do believe it's turning around, and more and more people are getting vaccinated. So, but yeah, it was just a connotation and the pejorative that was attached to the unknown of the different phases and what was happening.
And so that's the biggest message we have is that, there was a lot of issues early on with, maybe like you said, the mistrust. Are we sure we want to take this vaccination? I think, like you said, that's getting better over time now that we've had so many Americans who have become vaccinated and people are starting to see that, it seems to be safe and that people are still doing well. Some of those myths, like, is it going to allow the government to track me, right? Are they going to put something in the virus to track me? All those things, I know they got some traction, but the biggest thing that there's too many people dying, right? And having really severe illness that we really can't, take that chance. And so I've had my vaccination some time ago. I had the Moderna, and, people say, well, what's it like? Well, it's kind of like getting a flu shot or anything else, right? A lot of times you get a little bit of soreness at your arm, right where they inject it. Some people get a little fever, but only lasts like maybe 24 hours or so, not very long. And so it's very much like getting a flu shot or any other vaccination. You may have a little bit of a reaction there, but in the long run, it feels so good to feel like you have the protection, right? And that you're not going to get this.
And you had to do 2 phases of the Moderna, right? You had to take a
Yeah,
second
I got
shot.
2 phases, separated one shot, and then 28 days later, I got the other shot.
Now, are they doing the placebo in these vaccinations? Are they doing the placebo, which is the mental part of where it's solution, it's not actually nothing in it? Are they doing that in these? Every vaccine is an actual
No.
vaccine. Okay.
Yeah. That was in the clinical trials when they were testing
Right.
it out. Some people got the placebo, some people got the real thing.
Gotcha.
But now that the trials are over, everybody that's getting the vaccine, it's the real thing.
Okay. Okay.
It's the real thing.
Okay. No, we're getting better, because we have a history here. Like people are concerned, and then a lot of people were saying about the after effects and people who took it already We heard a couple of fatal casualties, so people was concerned. But definitely, more people now are scheduled to get it, and the millions are steady rising in the numbers who have received it.
I got a question for you, James. In your friends or family, how are people felt about it? Taking it?
Well, it was a different it was different perspectives across the board. Granted, those who know the history of they was concerned and people brought up the Tuskegee and all the history stuff. So, but definitely a lot of the ones I think we gotten better. I think a lot more now was saying they're going to get it. As
Okay,
is
good.
before, it was the polar opposite years ago. But I can truly say now it was more diverse and it was more people saying, well, I'd rather be safe than sorry and getting it. And so, especially when you think about the trajectory of how it all transpired, especially here in California. Like I said, we had been more restricted than anywhere else because it hit here first. Nevertheless, we were all on board in the beginning, total lockdown. Then people were like, what was going on? What was going on? And then a little by little, people said, well, I'm going to go out and jog in the fresh air. They begin to reclaim their life back. And so,
Yes.
and even now, it's still like not all the way, and people still like trying to get out, but not. And so, I think with with that process, and people are reclaiming their lives back the best way they can. You see the how some is still taking it serious, how some is like, I'm tired. Oh, like, I'm tired of wearing the mask. I'm tired. So it's like a lot of people are still not playing like they like. Okay, we need to do something because a lot of people are unprotected. People are taking this serious. I need to do something to protect me, and so I think a lot of people are also getting the vaccine because it's like a lot of people out there that are not, or that could be, a casualty to you or get you because they're not protecting and taking it serious. So it's like I need to take it serious because too many people that I see are not that are unmasked. They
Yeah.
probably not going to get the shot, so I got to be safe.
And think about what's going to happen. You think about around July, right? I
Yeah.
think it's going to get wild. People are going to really be trying to be done with the masks and eating indoors. So it's going to get like that. That I think people feel better having a little protection. Even myself, I haven't been on a flight, since this whole thing happened. But even when I get on a flight, I'm pretty sure, even though I've been vaccinated, I'm probably going to still wear my mask on a flight.
No, a lot of people are saying that. A lot of people are still wearing their masks. You know what I'm saying? And then also with the homeless, like people are the homeless being cared for? Are
Yeah.
they susceptible? We don't know if they still carry the traits of it. So it's like a lot of concern out there with that whole ordeal. And so I think that a lot of people want to definitely
Be careful.
hmm although
Now,
they were go ahead.
go ahead. Oh,
they they were different speculations because some people say, well, it don't do anything either way. But wouldn't you rather be, okay, if it don't matter either way, wouldn't you say it would be best for me to get it because it's a added protection
protection.
yeah, since I'm okay without it, wouldn't it be better if I just got to add it? Because they say, well, it don't matter if you get it now, you're going to do that. So therefore, if I get, there's no need to be hostile. Let me just get some extra added. Yeah, because that's people.
Protection. Yeah.
That's their point. Their point is, well, you don't make a difference. No way. You don't need the mask. So therefore, we don't need to get upset. If I want to get a little extra support, let me do
Yeah.
that for myself.
That's true. I
It's
agree with
okay.
that.
It's okay.
It's okay. Now, one thing I want to mention, people are asking me a lot about the children, kids, right? As you
Yes.
know, the Pfizer vaccine, 16 and up can get it. Moderna is 18 and up, right? For the
Ah.
ages, because they hadn't done all the testing. So people are
Yes.
asking, okay, when's it going to be? I'll say this. They've already been doing the testing for kids like from 12 to 15. They've already done a lot of those tests, especially with Pfizer. So now they're looking at all that data to see, okay, when's it going to be safe to then give it to those kids? I just read today, Moderna, the other vaccine, they just started actually testing it on kids 6 months of age and above. But this is going to take some time. But they do tests. So as the other day, Dr. Fauci, everybody knows him. He said
Yes.
it looks like, when will kids 12 years old and up be able to get the vaccine? Maybe in the fall, maybe around September. I was hoping it was going to be before that, maybe about that time. And then the question, when will all kids, 3, 4, 5-year-olds and up get it? It may not be till 2022. So it's still going to be a little while, but now we're starting to learn these kids can still go back to school. And, the one thing I read some data that when you looked at all the deaths with COVID, it was only a very, very small percentage were with kids. So kids, like you say, they may encounter the disease, the virus, coronavirus, COVID. They may encounter it, but they tend to do very well with it, and they don't get really sick and don't die as much. So that's the idea. But I just want to let the viewers know that when it comes to vaccinating the kids, probably in the fall of this year, the age 12 and up, and then a little bit later on, it'll be for everybody.
No, that's amazing. So you're going to bring a lot of relief to the parents, because I know that they've been driving them kids been driving their parents crazy
Yeah.
at the house.
And what's happening now, of course, most of the teachers have been vaccinated.
Oh,
And
that's
so
amazing.
a lot of the school districts in Los Angeles and surrounding areas have started back now with hybrid. And then I think other school districts by April are planning to bring the kids back. So it is getting back. And then we'll hopefully go to summer. And definitely by next fall, it should be a lot more in classroom instruction, which is needed.
That's amazing. So even with the K through 12, you think by the fall?
Yeah. I think they're gonna go there. Even I've heard even some of the school districts this year, by like late April, May, are going to be opening up for up through 12th grade.
Amazing. Because a lot of kids, have been two graduations, no graduation, no prom. It's been really sad on the kids, but I'm glad we got it under control now. We bringing it back, and you just gonna bring a lot of relief to a lot of people because they had a lot of concerns about the vaccination, and so this is progress and relief. You know what I'm saying? So and the casualty number is down, which is the main thing. Because I don't really think we even had enough. We haven't even had opportunity, like you said, to reflect on the devastation of the COVID or how many lives we actually lost.
And those numbers. It's over 530,000 people have died in the United States. So it's been quite a lot of people who have passed away. But like you said, when you look at more recently, that the number of people that are getting really sick like that and are dying has really gone down. And so by getting vaccinated, right? Again, even if you could still be exposed to the virus, right? The chance of you getting a really severe illness or getting hospitalized or dying, I mean, it goes down drastically. That's the whole point of getting vaccinated. So
that's amazing. We here at King Simon Entertainment Media Group so excited to have another interview here on KS News with Dr. David Pryor, who come to talk about the wonderful updates of the vaccine. We're so excited to have his knowledge, his expertise here today. And I guess we can conclude with the wonderful, wonderful additional, if he's not already doing amazing stuff, he has a new project that's coming out. Hopefully it'll be here by the summer. He's going to tell us a little bit about the Women's Health Organization website. Yes, .com, womenshealth.com.
Yeah, it's actually called blackwomenshealth.com.
Blackwomenshealth.com.
Blackwomenshealth.com. Yeah, and it's going to be launching hopefully no later than May 1st of this year, maybe a little before that, but it's going to be launching. And really, what it really is trying to speak to African-American women, right? Trying to live a healthy life, trying to be physically strong, mentally strong, and spiritually strong, right? All those things. We're going to be talking about health conditions, talking about nutrition, diet, exercise, a little bit of yoga, beauty, hair and skin, right? I know that's always important to our sisters, right? How do I, take care of my skin? There's a lot of advancements in that, right? A lot of new African-American owned skin lines coming out. And so it's going to be exciting, and we're really looking forward to it. So I'd love to come back on when that launches. And
no, that's are you thinking about adding product and stuff like to the organization products?
We are going to have products on there. There's two things, there's obviously a lot of products that are being developed and have been developed by Black doctors and others in the skin line. So we may certainly highlight some of those products, but down the road, we may be into creating some ourselves. So we're going to try to
Absolutely.
bring the best of what's out there and highlight it and showcase it on the website blackwomenshealth.com. And so we're excited about it.
No, it sounds like a great idea. I'm excited. I can't wait. Have a wonderful Dr. Pryor product. I mean, it's going to be amazing, amazing, amazing. So I'm glad we got an exclusive. And yeah, so I'm glad that it was announced here. And hey, beautiful, beautiful thing, because that's really huge right now, especially a lot of organic products, a lot of
Yes.
definitely medical tied to conditions like with, alopecia and hair loss and hair growth. And so a lot of that stuff is tied, of course, to what we eat and everything. So it'd be wonderful that you bring in the medical dynamic to that, so we can definitely service ourselves and our health better. So I'm excited about that. Can't wait till you come back on and talk about that as well. We're
Thank
here
you.
with Dr. David Pryor. I'm talking amazing doctor, medical doctor, internal medicine, and the wonderful work he's doing in the health profession and women. Thank you so much for coming on, talking to us about the vaccine, about the updates of COVID-19. It's been very tumultuous, but now we have a little bit more peace of mind thanks to you, Doctor. And just wonderful, wonderful work you do. Just keep doing what you're doing. And definitely, friend to the show, Dr. David Pryor. Please let them know your social media handles, how they can get in touch with you, how they can connect with you.
Yeah, and I'm building that up right now. It's the best place is to go to blackwomenshealth.com. It's actually live now. We're still tweaking it a little bit. You can go there, and it's David Pryor, MD, on most of the social media handles. And I want just to end by saying thank you, King Solomon Entertainment, what you're doing for the community. You're putting out great information, and as long as you're doing what you're doing, I'd love to come back and be part of it, okay?
Amazing. I appreciate you so much. And you would do just that. Friend to the show, Dr. David Pryor. Thank you so much.
Thank you.
Have a great rest of your day. We enjoy you. Thank you so much.
All right. Bye.
Um, there you have it. Another great interview with Dr. Pryor. Wonderful, wonderful information. Make sure you guys share this link, share this video. Wonderful information about the updates of the vaccine that he just shared with us. He'll definitely be back on. Wonderful things he's doing in the health profession. If you have not subscribed, please take the time now to subscribe. You see it on our title, King Solomon ENTCO and Medical Group on Twitter as well as the YouTube. Please subscribe to the YouTube channel, as well as Facebook, King Solomon ENTCO, as well as LinkedIn and on all the other social media platforms. We appreciate you guys so much for joining us. Until next time, King Solomon KS News